have any audio. Like the ones downstairs, they should be talking, right?
Good afternoon, everyone. Welcome to Public Safety. Lauren, will you please call the roll?
Legislator Foley, Legislator Santulli, Legislator Soskin, Legislator Hood Jr., Legislator Cornell, Committee Vice Chair Legislator Paul, Committee Chair Legislator Earl.
Present.
We have a quorum.
Thank you, Lauren. Adoption of our minutes from June 1st, 2022, and also June 14th, 2022 meetings. Moved by Legislator Soskin, second by Legislator Paul. On the question, all in favor, all opposed, minutes approved. Item 1, referral number 5327, approving a purchase in excess of $100,000 by formal purchase order in additional amount of $100,000 for the new total contract amount not to exceed $187,788.68 under RFB-RC-2021-001 from Atlantic Tactical, Inc. For the purpose of additional law enforcement, EMS and fire and emergency service equipment and related supplies for the term from January 26, 2021 through February 25, 2024. I'll move it, second by Legislator Foley. On the question, I did see Mr. Brennan, Paul Brennan, are you unmuted there?
Yes, I am.
Okay. Could you just shed a little light on this?
Sure, this particular vendor provides all sorts of law enforcement and emergency services type of equipment, from handcuffs to rescue equipment to particular types of clothing. It's used extensively by the Sheriff's Department, District Attorney's Office, and Fire and Emergency Services. We get percent discounts off the different brands that are in their catalog and online catalog. And we're asking we spent $87,000 to date, and we're asking for another $100,000 all the way through February of 2024, which would be the end of the contract.
Okay. Legislators, any question on it? Okay. All in favor? All opposed? Motion carried. Paul, do you mind sticking around for this next item we have?
Sure.
Please? I'd like for you to.
I'll be here.
Okay, thank you. Referral number 2, item 9540. This is a discussion item request for the introduction and update from Mr. Daniel Ortega, Operating Engineers Local 825 President. Okay, thank you. And there is, we handed out some, okay. Did everyone receive one of these? Okay. All right. Like I said before, he's Mr. Ortega is from Operating Engineers Electrical 825. He's here to just introduce himself and tell us about him and all that he does. And we thank you for coming in, Mr. Ortega.
Local 825. We represent heavy equipment operators throughout the state of New Jersey and 5 counties in the Hudson Valley. We have Rockland, Orange, Delaware, Sullivan, and also counties. I like to roughly say that we cover anywhere between May to Kingston.
Mr. Ortega, pause for 1 second there. Mr. Brennan, did you hear him at the beginning? You're muted, Paul. Did you hear?
Yes, I can hear Mr. Ortega, yes.
Okay, thank you. All right.
Yes,
Thanks.
I like to explain that roughly we cover the entire territory between Kingston, New York, and Cape from the Delaware to the Hudson. We met with the Honorable Legislature a couple of weeks ago, and he recommended that we come before you to introduce ourselves as an organization. I handle community affairs and government relations for the organization, so I deal with a lot of elected officials. And we just wanted to come in and talk a little bit about what we do and the impact that our members have in the different communities here in Rockland County. We have approximately 8,200 members in our union, and about 2,000 of them live in New York, and we have about 400 of them who are Rockland County residents. So it's important for our members to make sure that we have really good relationships with the elected officials because they're not only coming to work here in Rockland County, many of them work here as well, and they raise their families here. The majority of the work that our members do, it's heavy equipment, highway and roadway construction, bridges, roadways, and stuff of that sort. I like to explain that, what they do, it's they move dirt around from point A to point B, but it's a little bit more complex than that, and there's a lot more nuances. We have a training facility in the town of Wawayanda, and we have a large facility also down in the off the turnpike in New Jersey. We're always trying to make sure that our members continuing the education that they need to make sure that they have the utmost safety as part of what they do every day on their jobs. We just are not moving dirt around, but making sure that the communities that we work in are impacted by the work that we do have the high quality of work that they deserve. For the past couple of years, we have been working with the legislatures in different aspects, both at the state and the county level, particularly when it comes to economic development and safety and overall safety for our members and the work that we do. We want to make sure that the work site, when they're working, has appropriate construction equipment and is being operated by the right people. We don't want to see neither at the public or the private sector when jobs are being performed by people using this type of heavy equipment that they're being used by people who do not have the proper credentials or who do not have the proper knowledge and skills to do this type of work. And that's one of the major things that we talk to our members and make sure that they are capable of when they do their work. We have been following a lot of projects throughout the county, particularly here in Rockland County. We're very excited about a lot of the opportunities. We're also very excited about all of the funding that is coming through the federal government in particular, and that is going to trickle down to the local governments, and how we're going to see an actual finally effort being put into making sure that the infrastructure that we use every day is being up to date and is being upgraded and is being taken care of. In many cases, it's finally being repaired. And when I talk about infrastructure, we're not only talking about roadways, which is something that we see every day, potholes and things of that sort, but also things that we don't see every day, such as water and sewage, which are important portions of our daily lives and that sometimes we take for granted. Additionally, we also have put a lot of emphasis in the past couple of years in energy in different aspects, reliability and affordability, making sure that, like you said before, we have a lot of members that live here in Rockland County. We want to make sure that they stay here in Rockland County and they can afford to live here. And energy, not just in gasoline in the pumps, but also the way how we heat our homes, so we cool them in this time of the year, and making sure that energy is affordable, and natural gas is one of the ways how we have been working. We do everything in terms of energy. We do solar, we do wind, we do hydro, but we also do natural gas, and that's one of the things that we're always making sure that we talk to elected officials about. And if in the future any of you would like to further have a conversation with us about what it is that we're doing in terms of energy and how we are trying to advance better technologies, please feel free to reach out and let us know. so that we can have a better conversation on that. I'm not sure if anybody has any further questions. I don't want to take all the time. I can sit here and talk about construction for the next 3 hours, but I'm sure that everybody has much more interesting things to listen to and to hear. And if anybody has any questions in particular that would like to learn more about our organization, whether it's now, which I'm here for, or if in the future you would like to reach out to us, we're happy to come back and have a conversation, whether it is in a one-to-one or in a group setting, whichever it's much more convenient and easy for everybody. Happy to come back anytime. And I also just, I have these are straight balls that are in the form of, and I have about a dozen of them here. So I'm going to pass it around so everybody can have it.
Okay. We appreciate that, Mr. Ortega. Just one quick question. What's the average wages of your employees?
In terms of salaries, it really depends on the skill of the employee. I try to explain to people who are much younger than I am that if you are a really good crane operator, we don't cover the city, but if you were to be working in the city when construction is booming, you can easily make $250,000 working as a crane operator. I mean, it's long hours. It's a lonely job. You're by yourself, 40, 50, 60 stories high, doing 10, 12 hours a day, 6 days a week. But it's a very highly paid job. I always say it's it's good lawyer job salary without the headaches of being a lawyer. I'm going to say that it's probably in the mid to 90s, mid 80s, depending on the construction, depending on the year, depending on the work. We've had members that signed up to do pipeline, natural gas work. When it comes to the big multi-miles, large projects, they make a really good living. It's, especially those who are towards the end of their career and they're looking to retire, they look at this as, I'm going to go there, I'm going to work there, I'm going to make a very large, significant amount of money, and then I'm going to retire and be happy with all of the other benefits and all of the other earnings that I've had throughout my career. But if it's, look, it's construction work. When construction is happening, our members are happy and they make a very good living. But it's a very good way to overall, when it comes, we're always talking about, I'm going to take a step back a little bit here. We're always talking about changing the mentality that kids, particularly in high school, have about higher education and what the careers they should and should not pursue. And I think that being a operating engineer is a very good way to make a very good living and have a good long-term stable job without having to have the burden of going to college and getting all the debt and all of that. And doing the college route is a very good thing, and there's people who are very well equipped to do that. But keeping in mind the trades in general, but being an operator is a good also alternative to raise a family and to have a very good living in a very good environment. Our union itself has about 10 to 12% of the membership who is female. It's compared to other trades, is a very large number. Overall, it's, we wish we had more, and we're always working to have more. As a matter of fact, a couple of years ago, we had a class of 40 where 20 were female apprentices, which is a very big number. And I always say that, look, if you are the lady in an excavator and someone says something you don't like, you can smack down a little bit with the boom. It's a different style of work. You're not necessarily working right next to someone. You're working with people where you're not confined to a space. So a lot of the more less appealing aspects of working in a construction site that will be towards a woman are not as prevalent when you are in a big equipment by yourself, making a big hole in the ground. But overall, it's a very good way to earn a living and to have a very long-term career. I've actually have met people in the same business that I do of going to meeting and going to organizations whose parents are in the union, and they raise their kids as construction workers in different aspects. So.
Mr. Tager, you said 10% of your workforce, well, female. What about people of color? What's that percent?
The numbers on that, but we're always working with local elected officials to make sure that our membership represents the communities that we are working in. You know, I'm not gonna lie, you know, there are some groups that are much more highly represented than others for a very long time. You know, if you look at our membership that comes out of the city of Newark, are much more Hispanic than the people who come from other areas of the state. We're always working with different groups and different organizations to make sure our apprenticeship application process, it's very blind when it comes to a lot of that, and we really don't know. And nowadays, it's actually done all electronically, so we actually don't know who the person who is applying is until we actually start the interviewing process. I think that for a very long time, you know, some communities have not been very open to work with us. Like I've been doing this for 8 years, and I've always worked with local elected officials to make sure that their communities are represented, particularly when it comes to apprenticeship programs and to at least applying and getting people to the door. But sometimes, you know, it's very difficult to get there. There is still a perception that construction is not the way how you want. You know, very rare you raise your kids to say, well, I want you to go and be a crane operator, or I want you to go and grow up to be an excavator operator. We want our kids to do better than ourselves. We want them to be doctors and, you know, and have engineering degrees and have all of these other degrees. So I think that until as overall as a society, we all start looking at some of the trades as very good, viable careers, the way how they are, we're still going to have some roadblocks along the way on that. But overall, we're always working with different communities. We're always working with to make sure that our membership represents the people that we're, you know, where we're working.
Okay, well, thank you so much for coming in, Mr. Tager. I'd just like to just add, when we previously met, you had a very good safety program already implemented in your union, and I applaud you for that. Thank you, and thanks for coming in. The next full legislative meeting, I'll let the rest of the legislators know that you came and what you shared, okay?
Very well, and I really appreciate it. And again, if anyone, you know, most of our contact information is there, and the chairman has my, you know, my phone number and my email address. So if anyone would like to have any follow-up, we'll be more than happy to do that and to talk more about the things that we're doing. And really appreciate the opportunity, and thank you very much, and enjoy the little stress test.
Yeah, thank you. Thank you for these. Yeah.
Have a good night.
Thank you. Hey, Paul, Paul, he's still with us. I'll try and save you one of these sweat balls, and I'll get you his form here, okay?
Okay.
All right, thank you. That concludes our public safety. Motion to adjourn, moved by Legislator Santulli, second by Legislator Soskin. We are now adjourned.
The polio thing is supposed to start soon.
We got a quorum. I'd like to call this meeting of the Multi-Service Committee to order. I'm going to ask the clerk to take the roll.
Basha Tonio. State Joe. State Annie Paul. State Owen Wieder. State Vincent. State McDarren.
You've got me
There's Askin.
here.
You have a call.
Harriet Cornell is a member too of this committee.
No, you're not on multi-service.
Okay. I'm here anyway.
You for,
Okay, I would like to start with the adoption of the minutes of the June 28th meeting. Will you moved by Legislator Earl, seconded by Legislator Paul. Any comments, changes? All in favor? Anybody opposed? Unanimous. Okay, we're going to start with some very special things. We have a few discussion items. I promise people on the Board of Health who were asked at the last minute about this to speak on it. So the first item will be the item number will be right at the end. Okay, it's a resolution regarding monkeypox. And I'm calling upon legislator.
She's here.
Oh, okay.
Maria Soto.
Marcia.
Who's going to talk about?
That's her.
Well, let's talk about monkeypox now.
So actually, I just want to read one sentence here. New York Times, Monday, July 25th, shows that New York City is living through a sixth wave of COVID-19 at the same time that a new virus, monkeypox, has appeared. Over the weekend, the World Health Organization declared monkeypox a public health emergency of international concern. That is a designation the WHO currently uses for only two other diseases,
What's her name?
COVID-19 and polio.
Which one?
Monkeypox in New York City, New York, there's
You
more
don't
than
know. Okay.
1,000 cases.
I got it on my computer.
So I just want to see how we can take care of this monkeypox here in our Rockland and how many cases we have and what we are doing with the vaccine. I heard there's the treatments also, and I know I appreciate our health department doing everything up to date. I know I read all that. So I just want to know what we are doing for this monkeypox.
Okay, so thank you for inviting me. We're back again. So the monkeypox, so you have an idea what it is a very rare disease, and it is a virus that's from the same family as the variola virus, which is the old smallpox. Many of you remember smallpox, and it's the same family, but it's not as lethal as the smallpox was. The symptoms are very similar, but they're milder and, like I said, rarely fatal. Rockland County at this time has 3 cases with 1 pending. The U.S. has, I was looking it up, the U.S. as of July 25th has 3,846 cases. We have 3 in Rockland. And as you were saying, monkeypox by the World Health Organization was recently considered an evolving outbreak that's of concern for the world. It is not a pandemic, it's an outbreak, very different, all right? So basically, because not all the countries in the world have it, there's only 74 countries that have it at this time. That's why it's only an outbreak and not a pandemic. So there's a lot of criteria that the World Health Organization must find before it decides to make it a pandemic. And it only becomes a pandemic when all 119 countries, I think we have, I don't even know how many we have anymore, all have the disease at the same time, like we did with COVID. So that's one of the differences with this. So that you know, monkeypox was first discovered in 1958. It was a pox-like disease, and it occurred in a colony of monkeys. That's why it's called monkeypox. It's not, has nothing to really do with it. That's the first time it appeared. And what happened was, they think that it's able to go between the zoonotic, which is the animals, to the humans, which is what happened. So the first cases of monkeypox was in 1970 in the Democratic Republic of the Congo. And then in 2022, there were several Central and Western African countries started seeing an increase in the cases again. One of the things we have to remember, we didn't see this disease for this virus for many years because we got the smallpox vaccine. And we stopped giving it in 1980, it was eradicated. And so when we were getting the smallpox vaccine, we were also getting rid of monkeypox. But these viruses are very smart. And it's been 30 years since we've given out a smallpox vaccine. And because of that, you'll see them rear their heads, which is what is happening now, and causing this outbreak around the world. All right, so that's a little bit of history just to understand that this crossover with the vaccines, it does protect us, but we eradicated one, but another one decided, well, you know, I can now come out because I'm not as lethal as that one, so I will do some harm. So that's where we are today. So like you said, the World Health Organization did do that, considered it a public world health issue, but it's an outbreak, not a pandemic. What we know about the monkeypox right now is that it has to be close, intimate contact to get monkeypox. It's not like COVID, where it's airborne and you were coughing and sneezing and everything. This literally has to be very close, intimate contact to get it. All right. It could be a fomite. In other words, if somebody who had it touched something and it landed on something, it would. So any of us in here, our chances of getting monkeypox are slim to none because none of us here have been exposed to monkeypox. Right now, what we know is that it's in the LGBTQ community. It's not a sexually transmitted disease. What it is intimate contact. All right. So what we are trying to do is offer the Jynneos vaccine, which is a smallpox vaccine, to the people in the community that are high risk for this disease, for this virus. And I believe that we've given out about 83 doses here in Rockland County between us and the Pride, Nyack, through the Pride Center in Nyack. So we've been working very closely with our community partners to make sure that we vaccinate as many people as possible. We're doing it through our sexual health clinic. It's easier. The doctors are there in case there's any issues. They can see the patients and also be treated at the same time. There is treatment for it. And let me go back to the vaccine a little bit. The vaccine, one of the things you have to, if you are exposed, you should get you can get the vaccine within 4 days. It will protect you without getting monkeypox. So there is a way of protecting people and keeping people safe from this virus. We don't intend, I think it came out recently that there were 2 children that got exposed, not here in the United States, outside, but it was unfortunately because their parents were MSM, and unfortunately one of them brought it into the household. So like I said, it's really, really close contact. So even though it's a health issue, a public health issue worldwide, it's It's not a pandemic, it's an outbreak. So we are trying to keep it contained here in Rockland. And I think considering everything that's happening, 3 cases so far we've been very lucky and have been able to not have secondary cases due to those 3 cases that we have.
Said you gave the vaccination in high-risk areas.
I'm sorry, say that again?
High-risk areas, you're giving the.
Yes. Mm-hmm.
And also the treatment. You gave the treatment to.
We're the Department of Health. We don't do the treatments. They have to go to their physicians. Yes. So there is a treatment. Yeah, there is a treatment. You can, it's either pill form, and if they can't take the pill form, you can get an infusion. There's 2 ways of getting the treatment. It's called T-Pox is the name of the.
So this one is through secretion, contact with secretion?
It's not secretions, it's actually lesions on the skin. So if you remember your smallpox, many of us, we never saw smallpox, all right? It was eradicated in 1980. Some people might not have been born yet. But what they look like are they're raised, they're very deep skin, and they have pus in it. And they do cause scarring. So like I said, many of us have never seen smallpox. And since we were eradicated in 1980, it's a very classic look for those that have seen it in books and have read about it. And so the doctors are getting better at diagnosing it and figuring out how to do it. And we're working very closely with the community physicians. They call us immediately, and we know what to do and get everybody treated, and also get everybody prophylaxed with the vaccine if necessary.
What is your advice for the community? Everybody is concerned or worried.
Well, that's why I said to you, none of us here are at we're very low exposure at this place. Unless you actually know somebody with monkeypox and you had a relationship with them, or you went out to dinner with them, or you spent hours with them in the same household, the chances of you getting monkeypox are very low. All right, it's not an airborne disease. The only time it becomes airborne is if somebody's opening up the lesions and then it goes into the air. But usually nobody's going to do that. So for the regular population, it's not a high risk. You have to just look at each family, has to determine what their risk is. But there is really no high risk to the families.
So that already under.
That's okay.
If anybody have any questions regarding monkeypox.
Aaron?
Oh.
Yeah, Legislator Whedon. On the vaccine, there is a separate vaccine for the monkeypox,
It's a smallpox vaccine.
so it's,
Because it's the same family. It's a pox virus, it's called. So the same vaccine that we give for smallpox, we give for monkeypox.
I know there were talk about a shortage of the vaccine.
Not that we're aware of, but we've been getting everything we need. We have not seen nobody's told us there's a shortage. We're getting another 100 doses this week. We've gotten everything we've asked for. It's a 2-dose vaccine, so you get one now and you would get one 28 days later.
There were we're talk about a vaccine made in Europe just for monkeypox.
It's called Jynneos. I don't remember the company that makes it, to be honest with you. I never pay attention to the company that makes it. JYNNEOS, it's spelled. I can look it up for you in a minute. But we have it here in the United States. We're getting it through the state and through the CDC. We are, whatever we need, we got. So I don't think I think you might be thinking of the IPOL, the polio. There's a difficulty
No.
getting for the adults. That one we're having trouble, but not for this.
On the vaccine for,
Right. Now, there's 2 types of smallpox vaccine. The original one, if any of you have a scar on your arm, was where they would actually literally take the virus and they would put it into your skin like little dots. And if you grew up, if you're born in the 50s and 60s, you would have gotten it because we got it back then and that's how they gave it to you. So if you find a little scar on your arm, that's probably what it is with smallpox vaccine back then. Yeah, those are the ones, but we don't give that because it's a live vaccine and we don't want to cause more problems. So we're giving the Jynneos, which is a attenuated, meaning it's a part of the virus itself that's not active, and all it will do is help you form the antibodies.
So I was just did a little search, I'm looking at the headlines. DC postpones second monkeypox vaccine citing shortage.
But that's DC. Here in New York State, that's one.
And then there's in Time Magazine, why monkeypox vaccines are in limited supply right now.
We're not aware of here in New York State, sir.
Struggling to find them, Forbes, struggling to find them. Well, I've just seen these things. So you say that in Rockland County, there's no
And New
shortage?
York State is the one who gives us the vaccine, and they have not told us there's a shortage. We're getting 100 doses this week, another 100 doses.
And that's for smallpox. You said it's called a pox vaccine?
It's called Jynneos. It's a smallpox vaccine, but it's the same type of virus. It's a polio virus. So this vaccine will cover the monkeypox and the smallpox. So it does both.
Okay, thank you very much. Yeah, one more
Thank you
question?
so much.
No worries.
From the New York Times. As if COVID and monkeypox weren't enough, there has been an outbreak of polio in Rockland County, northwest of the city. With the health department, they're setting up pop-up clinic, polio vaccination clinic.
Okay, so we do not,
Okay, so we're through with monkeypox.
Yeah, monkeypox is,
Okay, as I was saying,
you're welcome.
thank you. Will you be speaking about the polio?
Yes, sir.
Okay. Today I happened to be reading the newspaper in the morning and I noticed the disease polio. I was not aware, because I've been quite busy, that it was here in Rockland County. When I was a
So,
little younger, I was active in Boy Scouting. And up at Boy Scout camp up in Narrowsburg, New York, 14-year-old boy came down with polio. Okay, he couldn't walk. He was rushed to the hospital. He was put in an iron lung because he couldn't breathe. And within a short time, he was deceased. So it's a very serious thing. And I would like to just briefly get a description of how one would recognize it. Maybe it's very easy to recognize. Okay, but I don't know too much about it. And I was hoping that you would be able to give us some leads to find out if one has it. And I know there were only 1 or 2 cases thus far, but this is a very serious thing, much more so than monkeypox and other things. And I don't want to scare anybody, but I want to scare you. So please.
okay, so we do not have an outbreak of polio in Rockland. We have one case. That is not an outbreak, doesn't make, okay? We have one case that was diagnosed last week. So just so you understand, polio, yes, you're absolutely right. In the 40, it's a 20th century disease that in the 40s and 50s caused many children to die, be put in iron lungs, and become paralyzed. This is not like measles. This, if you get polio and you are paralyzed, it could be for the rest of your life. You will never get better. If anybody is of the age that grew up in the 40s and 50s, when the spring came along, many parents were very worried because they knew that that's when we would have the uptake of polio in the country. So you have an idea. The epidemics back then, there were about 20,000 cases of polio in 1952, all right? And the following, in 1955, the inactivated polio virus, which is the vaccine type, was administered and we started seeing less cases. And then by 1961, we had the oral polio. Anybody who's of my age and went to school here in New York State remembers getting online and getting a sugar cube with a little dot of a pink thing on it. That was your oral polio vaccine that was given to us back then. So those vaccines worked very well. But in the year 2000, the US stopped giving the oral polio vaccine, and we started giving just the IPV, the inactivated polio virus, which is the vaccine type. It's, the children get it at 2 months, at 4 months, at anywhere from 6 months to 18 months, they get the third one. And then when they go to school, they get their fourth dose, all right? So our children here, the majority of the children here in Rockland County are immunized against polio. What happened in this case was that we had a young person that was completely unimmunized, at some point was exposed to someone that at some point was administered the oral polio virus, but it wasn't given here in this country, it was given somewhere else. So that person was exposed to somebody, either that person came into the United States recently and got exposed, and it wasn't that the vaccine gave him the polio. What happens is that the vaccine reverted at some point and changed, and then it ended up being that it became the virulent strain again. And those that are unimmunized, for whatever reason, found this young person, and the person got polio. The polio, unfortunately, 95% of the people that are exposed to polio have no symptoms, sir. All right, so it's very hard for us to tell you this is what's going to happen. Because it's a virus, polio will develop some symptoms. It will be like upper respiratory, like all the other viruses that we have. They might have a sore throat, they might have a runny nose, they might have congestion, they might have a headache, and then it'll go away, and that's it. But in this case, this person unfortunately got the paralytic form, so this person is paralyzed now. The oral polio, we are now giving inactivated polio virus to the community also. So we've been working very hard to immunize as many people as they want to get vaccine. And we also are working with our partners in the community. We're working with Refuah, we're working with the physicians, we're working with Sun River Health, we're working with some of the urgent cares to have available the vaccine for the community, for the Rockland County residents that wish to be immunized. We are not, if anybody doesn't remember if they got the polio vaccine, they can go and get it. It will not harm you. If you're not sure, you should speak to your physician. Problem is, like I said, polio, 95% of this are asymptomatic. They have no symptoms or don't know. They might think it's just a sore throat. I'm feeling lousy today, and they go about their business. But when a person starts getting pain in the feelings of pain in the legs, and like pins and needles, or a meningitis or any type of paralysis, then we know that we have to worry about polio. So we have it, this one case, we are trying to figure out where it came from. There's a lot of investigation going on right now. We are trying to work backwards and figure out where the person was exposed and how they got exposed. So at this point, there's no other cases but one. So we are just going to, but we are still being very vigilant. So we're doing active surveillance, which means that we are making sure that anybody that comes through the hospitals or to the doctor's office, they have to let us know. So we have to determine if we think that we have to rule out polio for that person. We also look at immunizations. If a person is immunized, that gives us much more of a
Okay, thank you so much for the information. I understand from your office that if anybody wants more information, they can, and they're computer literate, they can go to the rocklandgov.com.
correct.
To the Department of Health site, and under that you'd find polio, and you've got all the information written out there. I just wanted to, I'd like to give you more time, but we just don't have it at
That's
this
okay.
point. Okay.
Mr. Chairman, may I ask a question of the commissioner?
Okay, but make it fast. Go ahead. And Tony's next.
It's okay.
Go ahead,
Uh,
Harriet.
Commissioner,
No, it's Maria. It's not the commissioner.
I'm sorry.
That's
Um,
okay.
As an older person, I have no recollection of whether I was inoculated as a child or not. I just wondered, how does one know whether it's to try to get inoculated now?
Oh, you can come you can go to your physician and ask for the vaccine. We are not telling anybody not to take it. We had quite a few older patients come to our clinic on Friday to get the vaccine, because if you don't remember and you want to get it, absolutely. There's no reason why. We're not looking at immunization records unless they're a child, then we'll look. But for
Okay.
for older residents, if you feel that you want to get the vaccine, you can.
Let me just go. I have an answer for that, Harriet. This is before completely eradicated this polio vaccine was given to all the kids when they are young. I think you might have got it because I'm sure at that time we have all vaccinations set. As a pediatric NP, I have seen many cases which came from another country, but we make sure the health department, we get there. Even we got facts from the health department of other country, what they have it, and if they do not have enough or up to date, then we give it according to the age we have that. So I think that time, your age time, they should have given you. Everybody gets that.
Okay, thank you very much for that. I certainly don't have any records of it. It's a long time ago. It was a long
Right.
time ago. I remember being frightened by it because of hearing so much when I was, 11 or 12, but that's been a long time ago. So I just wondered, but thank you very much for the information from the health department and Annie, thank you for that as well.
Okay, go ahead. Thank you, Mr. Chair. Thank you. Very informative presentation. Are you privy, just to give us a little bit more on the condition of the one and only case we have in Rockland County?
He's not our patient. That person is not our patient. So I don't, we just know that we know it's paralytic polio, and that's all we know. They are being followed by the physician, and that's all I can really say.
Okay, that's what you said before. Thank you.
I don't want to jump in here, but the front page of the journal.
Is he paralyzed?
It's paralytic polio, yes.
Oh, okay. I missed that. All right,
Yeah.
thank you.
The front page of today's journal news indicates that there's a connection with the sewer district.
We have found the polio virus in a certain sewer district, but we don't know yet if it's from the one patient or if it's because it's a group of people. We don't know that yet. We're still in the process of determining that, and that is being done by Wadsworth and by the CDC. Water samples have been sent up to be tested, so we have to wait to see what the results of that. It's going to take a bit because they have a lot of water wastewater to test. So, like I said, it's very hard for me to say anything yet because we don't know yet if it's only from the one case or is it because it's already been in Rockland and we were not aware of it. That we don't know yet.
Okay, thank you so much.
You're welcome.
Tony, did you have this? No. Yeah, got everything.
Good.
Okay, I would like to thank you very much. I called up this afternoon at 3:00 and the health department was very, very cooperative. And I must compliment Dr. Rupert as well as the lady I spoke to over there, Maria De Soto.
That's me.
You're Maria. Okay. Thank you very much. I told you that you're going to get 3 stars. Now I give you 4 stars.
Okay, thank you, sir.
Okay, thanks again.
Okay, good luck. Thank you.
You can understand now why these 2 items were so important. And we're going to move very fast through the rest of the agenda and spend a lot of the county's money and the money that's been granted to us. Start with enabling us to do this, we have to confirm an appointment. So I'd like to start with referral number 2962. And if you don't hear me, please let me know. Confirming the appointment of Martha I. Robles, Suffolk, New York, as Director of the Office for the Aging. I'll move her nomination,
Second.
seconded by Legislator Paul and Legislator Earl. All in favor? Anybody opposed? Unanimous. Referral number,
I just want to say a couple of sentences.
okay. I'll
And
go-
the Martha is here.
Yeah, she's here.
Yeah, she's here. I just wanted to say that Martha has a great experience with in the community. I see her so many occasions. She worked with the Catholic Charity Community Service of Rockland, and you name it, so many community activities she's involved, and she is a great photographer. I see she has so much involvement in, like, she have masters in public administration, and also you name it, she have good experience, good, very talented. I am sure the Office of Aging, she will be managing that well, and good luck with her. Congratulate her. So you want to say something?
You'll forgive me for not going and letting anybody else speak, but we're rushed for time. Okay, I've read your resume and it's great. So
Thank you, and thank you, Annie, for your
we
kindness.
wish you good luck. Okay, all the best. All in favor? Anybody opposed? Unanimous. Referral number 8037, approving the acceptance of federal grant funds from the New York State Office of Temporary and Disability Assistance to the Department of Social Services in the amount of $721,128, no county tax dollars, for the Summer Youth Employment Program, and approving a memorandum of understanding between the Department of Social Services and the Youth Bureau for the direct operation of the program in the amount of $546,760 for the period from March 1, 22 through September 30th, 22. I'll move it, seconded by Legislator, McGowan. Okay. You want to just briefly, are you going to spend all this money this summer?
Good evening. This is the same annual grant that we get from OTDA. The department, it's granted to the Department of Social Services. We turn that over to the Youth Bureau for them to run the youth employment program.
I see. Okay, anybody have any questions? Seeing none, all in favor? Anybody opposed? Unanimous. Now we have a whole group of referrals from the Office of Community Development. Okay. The Alexandra S. Abrowski, the director, is here with us. I have one question before we go ahead. In accepting these funds, are we obligating ourselves to perform any services or doing anything in the future?
What respect, Legislator Soskin, you could see in
I
the
can't hear
backup,
you. Could just speak into the mic.
the materials that were provided showed the action plan that was developed by the Office of Community Development with the consortium, showing how the funding is going to be spent. So by submitting this action plan, we're committing ourselves in the event that HUD approves the action plan to then following through with what we're stating in the action plan.
Is this a standard operating procedure?
Yes, this is our annual allocation of funding from HUD. We get funding for 3 different programs: CDBG, which is the Community Development Block Grant Program; HOME, which is the Home Investment Partnership Solution Program; and ESG, which is the Emergency Solutions Grant Program. Every year we get this as an entitlement county, which is an urban, an urban county with a certain amount of population. We get this formula allocation from HUD, and then we have to decide how it's going to be spent to benefit the residents of the county. So this is as standard practice.
Well, I see. What I'm getting at is, are we being directed to do certain things? In other words, I've been reading the newspaper about HUD has certain obligations with regard to housing. I was wondering how and when we're committed.
We're not committed to doing anything that local municipalities don't want to do. Our funding is basically used for projects to benefit low and moderate income individuals and residents of the county. So there are certain public works projects you can see in the backup, sidewalks, road paving, drainage improvements, those sorts of projects are done in various communities throughout the county that meet certain income criteria.
I see. Okay, thank you very much. Anybody else have any questions? Hearing none, I'm going to let you sit down and I'm just going to go through them all. Okay, and thank you very much.
Thank you.
Referral number 3977A, approving the fiscal year 2022 submission of the Home Investment Partnership Program application in the amount of $1,048,751 with a 25% local match to be documented with the U.S. Department of Housing and Urban Development, and upon its approval, authorize the county executive to execute all necessary instruments, and to the Commissioner of Finance to establish new accounts. All in favor? Anybody opposed? On all of these, let's see, on referral number 3977A, B, C, I'll move it, seconded by Legislator Earl. All of them. Anybody opposed? Hearing none. All in favor of all of them? Anybody opposed? Unanimous. That's 3977A, B, C. There is no D. Referral number 36. Now we have a bunch of them that our new director of the Office of Aging is sponsoring. And I'll call up Ms. Martha Robles, Director of the Office of the Aging. Each of these is a more or less standard. Referral 3657A is approving an amendment to an extension of a contract in excess of $100,000 with Meals on Wheels Programs and Services of Rockland Corporation to provide for the operation of senior centers, congregate meals, transportation to and from centers to qualified senior citizens in the additional amount of $206,295 for the period July 1, 2022 to September 30, 2022, for a new total contract amount not to exceed $1,444,065 with a 51% local share. I'll move by Legislator Weider, seconded by Legislator Tyre. All in favor? Anybody opposed? Unanimous. Referral number 3657B is pretty much the same thing. Approving an amendment to a contract in excess of $100,000 with Northern Metropolitan Incorporated, doing business with Northern Metropolitan Residential Health Care Facility to provide the home division delivered kosher meals. Okay, in an additional amount to qualified people 60 years or older in the amount of $65,000 for the period July 1, 2022 through October 31, 2022, not to exceed $305,000 for the period from April 1 through October 31, 2022. I'll move it, seconded by Legislator Paul. Okay. All in favor? Anybody opposed? Unanimous. By the way, if there's anything that you think we should know about, okay, as I go through this, you'll please call it to our attention.
No, the only thing that's going on right now is the extension of the contracts until they're awarded and until the RFP process is over and we get to review the new proposals.
Okay, thank you. Referral number 3657C, approving an amendment to an extension of a contract in excess of $100,000 with Circle of Friends of Rockland LLC to provide social adult day service to eligible clients in an amount not to exceed $65,000 for the period from July 1, 22 through September 30th, 22, for a total amount not to exceed $265,000 with a 25% local share for the entire contract period from April 1, 21 through September 30th, 22. I'll move it, seconded by Legislator, Legislator Earl. All in favor? Okay, and we have one more, referral number 3657D, approving an amendment to an extension of the agreement in excess of $100,000 with Centro de Amigos to provide adult day services in an additional amount of $55,000 for the period July 1, 22 through September 30th, 22, for a new total amount not to exceed $280,000 with a 25% local share for the full contract period, April 1, 21 through September 30th, 22. I'll move it, seconded by Mr. Tyre. All in favor? Anybody opposed? Unanimous. Mrs. Martha Robles, thank you so much. Good luck to you and your new position. Okay, and we'll look forward to seeing a lot of you in the future. Referral number 2973. Paul Brennan, you're up next. Approving, exercising the first renewal option from July 1, 22 through June 30th, 23, and the First Amendment to an agreement in excess of $100,000 with an additional amount of $96,000 for a new total amount not to exceed $192,000 with Mental Health Association of Westchester Incorporated to provide sex offenders evaluation and treatment services for the County of Rockland Department of Mental Health and the Department of Probation for the full contract term from July 1, 21 through June 30th, 23. Question. My math isn't too good, but 100,000 plus 96 should be 196,000. Am I correct on that?
No, we spent 96,000 the first year of the contract. And
First, okay.
okay, we're adding another 96.
I follow it. All right, that's okay. I'll move it, seconded by Legislator Weider. All in favor? Anybody opposed? Unanimous. Another one for Mr. Brennan, referral number 9326, approving exercising the remaining two optional terms and Sixth Amendment to an agreement in excess of $100,000 in the additional amount of $17 million for a new total contract amount not to exceed $33,458,225.24. I like when people are exact. Under RFB RC 2019-065 with Student Bus Company Incorporated for the transportation of preschool and early intervention children with special needs for the County of Rockland Department of Health for the term from September 1, through August 31, 2024, with no renewal options remaining. I'll move it, seconded by Legislator Weider. On the question, how does this mean we have to renegotiate a contract?
We did have to negotiate some parts of it under our standard contract clauses. The busing contracts have been difficult for the past probably 3 or 4 years with COVID and the driver shortage. Before that, it's very difficult, very competitive in terms of the driver market. And we negotiated additional increases which are allowed under our contract terms, as well as changed a couple of the terms of the contractor to give the contractor a little bit more flexibility in terms of the size buses they use and the age buses. Right now, our contract calls for buses have to be within a certain number of years old. However, just as the county cannot get trucks delivered, school bus companies can't get buses delivered either due to the supply chain issues. So we had to raise the age of the vehicles. They still have to all pass DOT inspection, and they're inspected on a quarterly basis. So there should be no issue about the safety of the buses because they still have to pass, independent state DOT inspection.
I see. How do we manage with the increased cost of fuel? Is there any sort of escalation clause to
Yeah,
reimburse them?
there's a fuel surcharge built into this amendment. It'll go up and down, so it's less, the amount they would receive is less today than it was a few weeks ago when we finally agreed on terms. So it will continue to come down if prices come down. If prices go back up, then the contractor would be entitled to a fuel surcharge.
Okay, thank you very much. Anybody have any questions? Hearing none, or, I moved it. We have a second? Okay, all in favor? Anybody opposed? Unanimous. Thank you very much, Paul.
You're welcome.
Okay, we have two items left, both through the Department of Health. $39.7. Okay. Number 12, 9372, approving entering into an agreement in excess of $100,000 with the amount not to exceed $203,491 under REP RC 2022-012 with New York Analytical Laboratories Incorporated to provide diagnostic and analytical testing on water parameters for the Department of Health for the period from July 1, 22 through June 30th, 23, with 4 one-year renewal options. I'll move it, seconded by Legislator Tyre. Anybody have any questions? All in favor? Anybody opposed? Unanimous. Okay, thank you, Paul.
You're welcome.
Now we have two items coming through the Health Department. I understand that Mrs. McMahon and John Powers are going to be talking on that. So let me read them. John. Could we combine them? Okay, referral. I can't hear you. Could you speak?
Melissa
to the mic?
Jacobson is attending virtually and she can speak on the next matter.
Number 13.
Okay, so let me read it. Referral number 8634, approving a contract in excess of $100,000 with Child Care Resources of Rockland County for creating healthy schools and community grant in an amount not to exceed $185,000 for the period June 121 through May 31, 26. Okay, I'll move it, seconded by Legislator Paul. Want to tell us about it, or?
Sure. This is Melissa. I'm on virtually. This is one of the subcontracts with our Creating Healthy Schools grant. It'll be for the next 5 years, and this is for the early childhood education component of that grant.
I see. Anybody have any questions? Hearing none, all in favor? Anybody opposed? Unanimous. And the other one is approving an intermunicipal agreement between the County of Rockland and the towns of Clarkstown, Haverstraw, Ramapo, and Stony Point for the operation and maintenance of the Rockland County Animal Shelter for the total contract not to exceed $247,142.70. no county tax dollars for the period from January 1, 22 through December 31, 22. Is that supposed to be pulled?
Oh, it's not
You
pulled?
want to
No.
just explain that?
No, yeah, sure. This is the contract we've been doing for, this will be the 5th year. Orangetown has left, but this is with the other 4 towns to reimburse us for running the animal shelter. So it's with Stony Point, Haverstraw, Clarkstown, and Ramapo.
The supervisors, and
Yeah,
you all agree to this?
They agreed to it 5 years ago, yes.
And the cost to the county now is going to be $247,142.70.
Correct,
Reimbursements, and this is for maintaining the animals?
correct.
I'm a little surprised. Is there a rush on this?
Yeah, we'd like to get we've been doing, yeah, we'd like to get paid for it.
Okay, well, anybody have any comments?
Steve, can you just explain to us how the difference is being made up with the town of Orangetown withdrawing from the
Yeah,
contract?
it'll be the contract's supposed to be adjusted accordingly, like, they, since we're not getting the animals from Orangetown, then, they shouldn't be getting paid for it.
Okay.
I mean, the original agreement we entered in 5 years ago, with High Tour had the full amount, and then since Orangetown dropped out, they should be getting compensated less due to the fact that Orangetown left.
The county won't have to make up any difference.
This is to this is for the current year.
The 50 year.
This is to feed the animals, and what's this for?
Yeah, this is
I can't,
right.
please speak into the, I can't hear.
Okay, right now, High Tour operates the animal shelter.
Right.
Okay, and we pay them a certain amount of money, and the towns agreed to pay this amount. And it's based on the annual intake on a certain year, I believe it was 2016. And, this is what the towns agreed to pay, and we've been getting this money, this will be the 5th year.
See. Okay. I'll go along with this. Do you have an agreement already?
No,
With
this
the
is the
towns?
agreement.
Is there a
Well,
written agreement?
this will be the written agreement. We have an oral agreement, we've had, this will be the 5th year of it. This will be the final year.
Okay. I'll put this through pending submission of the agreement by all the supervisors of the towns. You have it, just get us a copy of it. Or maybe there is a copy.
Well, this is the agreement, the agreements are attached as backup to this. Well, we received a letter from Stony Point, as soon as we sent it out, that they were putting it on the agenda.
It was my understanding this was all put on hold.
Mr. Chair? Me?
Yeah. Or something, Mr. Weider?
This, because this is also on the Budget and Finance Committee, so I went back and looked at the back of documents and I had a conversation with Mr. Powers. What this is what we have done for many years. In other words, the county is getting reimbursed what we had a contract with High Tour. This is not going forward. And in fact, this is the final installment based on the contract the county has with High Tour. So for 2022, by December 2022,
December 31st.
December 31st, the contract with High Tour is over. And going forward, 2023, the the towns have to come up with some sort of an agreement or understanding with the county how we're gonna move forward. But as far as what we're doing tonight is to reimburse the county what the county has already paid out and laid out.
Well, they haven't laid it out because if we look here, it's dealing with a period from January 1 to December 31, 22. Now
Correct.
it's only July 22.
Because the county has entered into
Okay,
a contract with,
You have a contract currently, that's what he's saying.
yes, with High Tour. It's been a
All right.
5-year contract till the end of 2022. And every year we get reimbursed by the towns. So this is the final reimbursement from the towns. So that's what we're doing tonight.
Correct.
Okay, all right. All in favor? Wait, look. Okay. Okay, I'll move it.
Second.
Legislator Earl. And Legislator Weeder will second it. All in favor? Okay, unanimous.
Thank you.
Okay. Sorry for the misunderstanding.
Motion to adjourn.
Okay, that completes the agenda. Apologize for the delay. Second, moved by Legislator Earl, seconded by Legislator Paul. Meeting is over.
Okay. Good evening, everyone. Welcome to Economic Development. Les, please call a roll.
I get Cornell, please.
Legislator Cornell, still there?
Yes, I'm here.
Here.
People.
Here.
Legislative.
Senator Jim Foley. Start at 20.
Present. Thank you, Les. We have two items. Item number one, referral number 5128A, confirming the reappointment of Raja A. Amar of Stony Point to the Rockland County Industrial Development Agency. I'll move it. Second by Legislator Paul and Grant. Mr. Amar, are you here?
Yes, I am.
Oh, okay. Yes, just real quick, can you tell us something about yourself?
Well, I just want to say that, first of all, thank you for giving me the opportunity to re-serve on the IDA board. I actually enjoy it, and especially serving our community for all these years. So thank you for the opportunity.
Okay, thank you, and thank you for accepting, and congratulations. Anyone else have? Legislator Paul?
I just want to congratulate Raja, and I heard about you, and you are really a business leader in the community, and I'm sure you are an asset to this industry or this field. Thank you so much for your service.
Thank you, Legislator. Thank you so much.
Okay, thank you. Mr. Amar, next Tuesday on the full legislature, it'll be finalized. You don't have to come down unless you really want to, okay?
Thank you so much.
It's your option. All right, thank you.
God bless.
Okay, all in favor?
Aye.
All opposed? Motion carried, unanimous. Referral number 2, 5128B, confirming the reappointment of Howard Hellman of West Nyack, New York, to the Rockland County Industrial Development Agency. I'll move it. Second by Legislator Cornell. On the question, is Mr. Hellman, you here? Oh, okay, thank you. There you are. Would you just tell us a little bit about yourself? Yeah, you could It should be on.
Good evening, everyone. I've probably served on the IDA board for the past 10 or 12 years. It's been a great honor serving the community. It's great driving down the streets of Rockland, seeing some of the projects that the IDA board has worked on and approved. It's my honor to be reappointed once again. Thank you.
Okay. Congratulations and thanks for accepting this position again. And like I just said before, it's your option. If you want to come down next week, fine. If not, can, okay, skip it. Okay?
Thank you.
All in favor? All opposed? Motion carried unanimous. Motion to adjourn, moved by Legislator Foley, second by Legislator Wolf. All in favor? All opposed? We are now adjourned. Hey, Ilana.
Good evening, everyone. This is the, not that late, 7 o'clock meeting for tonight, July 26th, of Planning and Public Works Committee. Can the clerk please call the roll?
Thank you. Legislator Jefferson, Legislator Carey, Legislator Paul, Legislator Weider, Vice Chair Legislator Grant, Chairman Yeager. You have a
I'm here.
quorum.
We have a quorum. See any adoption of minutes? We'll take everything together except the appointments. So that is, oh, in fact, let's see, Stephen Coyle. Excellent. We'll take you first just in a moment, okay? Just give the legislators some time to review what we're doing. And while we're doing that, Skip, we're amending the capital budget to increase the Grassy Point Road Bridge over Minnetonka from, well, we're tripling the size of the project. Was that anticipated at the beginning, or is that something that we're doing for any particular reason? If one of you just wants to come up to the mic so everybody who's online can hear.
Porter Bridge, New York. We received funds from the state. As we developed the project, COVID came, and then with that, the increase in steels. And we've been having an issue with a lot of our construction projects is the increase in either supplies or materials. Part of it is trying to get the bridge done under a certain time frame, which also requires procurement of the materials under a time restriction. So we've been finding that structural steel, we've been getting some, it's either you got to order it within this week in order to have it within a year. So that's what accounted for. This was also rebid. So this was our second time rebidding, which has been lowered the cost by about $500,000 from the original bid.
It's a shame we're not making steel in Pennsylvania anymore, isn't it?
No, it wasn't.
Okay. Does anybody else have any other questions about that?
Just-
And is that why we're advancing the funds in order to be able to purchase them right away?
Right, well, that's it, yeah. Usually a lot of times it's the major structural items. And we need to pay that.
Okay. And we can't build it out of aluminum? I'm just kidding. Legislator Grant.
Al, this bridge is being paid for 80% federally funded, 15% state funded. And then the county picks up the balance. There's a cap on that, but the funds have to be committed by the fall of this year or we lose them.
Correct.
Okay. So
we're
we're bonding for the amount, the total amount, but we're being reimbursed almost $5 million from the federal government and the state government.
And do we use that to pay off the bond?
Yes.
Correct.
And any idea how long that'll take to come in? The federal funding?
We do reimbursements every quarter. So usually there's about 3-4 month lag.
Okay, so if we send them a bill for 5 million, we're gonna get it back right away?
in a year.
Okay, within a year. The question is, I mean, listen, I'm not gonna do the numbers crunching, but we have some money in the bank that we might want to do that instead of spending how much are we getting for the bonds now? Do we know? Is anybody here who can answer that question? I think that is a no. We should at least consider paying it out of our own funds instead of, and then getting reimbursed rather than bonding and spending the extra money. I don't know. Right? We have money sitting in the bank in reserve. It might be worth spending that money and then getting the money back rather than paying while we still have money sitting in the bank. Am I making myself understood? I'm sorry.
Mr. Chairman, I don't know if there's any legal requirements, entanglements related to getting the federal and state money. What you're saying off the top of my head makes sense. That if there's a substantial, we have enough money to advance the funds. How
Right.
fast will we be paid back is an important question, and what interest we're avoiding on the bond is, I think, your point.
Right. And I'm assuming that the money we have sitting in the bank is probably going to make less money than the bonds that we'll pay.
Certainly our 5%, I would expect,
Right.
I would see bonding for the 20-year life of them.
All right, could we have an action item on that to ask finance to try to figure out whether it would be worth it for us to use our own money in the bank rather than bonding this? Since we're going to get reimbursed, let's say within a year, whether we should spend the 5% when we have the money in the bank. I'm not saying that we should be left with zero, but it might be worth considering. Is that? Yeah. All right, with that, item 1-11, confirming the appointment of Stephen Coyle, Congress, New York, the Rockland County Home Licensing Board. I'll move it, seconded by Legislator Jobson. Okay, Legislator Jobson? Okay. If you want to come, just tell us a little bit about yourself, please. Thank you so much.
I'm Stephen Coyle. I'm a lifelong resident of Congress, Clarkstown area. Forward to serving the community on the licensing board. I'm in the insurance business. Our family's been in the insurance business since 1929 in the area. And I think that gives me a good background and experience in dealing with problems with the licensing board. So I'm looking forward to it. So thank you very much for the nomination.
Okay, are there any questions for the appointee? Seeing none, all those in favor, please signify by saying aye.
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 Say nay.
Mr. Chair,
Okay. Oh,
Mr. Chairman, I had a question on 1-9.
okay, well, let's finish with this.
Okay.
Okay, so passes unanimously. You do not have to come to the full legislative meeting. You can, but there's no back and forth there. So, congratulations in advance. I don't anticipate anything happening between now and then that will stop the full legislature from confirming you unanimously. And thank you in advance for your time. Okay, on item 1-9, authorizing the exemption of eminent domain procedural law, Article 2, hearing requirement for improvement of 2 intersection of Suffern Lane at Hammond Road and Suffern Lane at Thiels, Mount Abbey Road, Town of Haverstraw. I'll move it, seconded by Legislator Grant on the question.
Yeah, just curious what the exemption from the eminent domain. There's a little, there were two draft resolutions here. I got a little bit confused because one's 4.5 pages, the other's 2.5 pages. And I think the one property that's identified is state-owned, the other property is privately owned. I believe it's the corner of Rossman Road and Thiels Mount Ivy Road, and extends up to the intersection inside the guardrail. Okay. So I guess first I want to know that we engaged in good faith efforts to negotiate the purchase of that property, and they were not successful.
Yes, we've been trying for about a year and a half. There was just a lot of back and forth with the homeowner about certain things. We need to have free and clear title. So
Okay, and what's the total size of that parcel? Because there's no map on my,
I believe it's less,
we want 7,000 square feet, but
that's about right, yes. The total parcel size is much larger. It's percentage-wise, it's less than 10% of the total parcel, which is classified as de minimis.
And do we want a linear piece along that existing guardrail up to the Hammond Road intersection?
Right.
So that the circle can be, okay. because I'm expecting a call on this. But we're prepared. This resolution does not anticipate not paying anything for the property, does it?
No. Okay. Intend on paying, we just need a 4.
Okay. And it's been appraised. Okay, thank you. Thank you.
Oh, no problem. Of course. Okay, we're gonna hold that approval in abeyance and I'm sorry, I've just been informed. Is David Schnitzer here? Sir, so I'll move that confirmation to the Rockland County Board of Electoral Examiners, seconded by the Legislator Jobson. You want to just come up, tell us a little bit about yourself, please? Thank you very much, sir.
Oh, I see. Excuse me. Good evening, everybody. David Schnitzer, otherwise known as Dave. I've been a Rockland County resident for just 44 years, I think this September, actually. Raised all 5 of my children here. I've been a proud member of Local Union 363 my entire career. What I love to do most is I work with the youth in the county as well as up in Harriman State Park, and I rebuild a lot of bridges and roads and walkways for the summer camps up there. And that occasionally extends back down here into the county. I also chair a wonderful organization down in Orangetown called OVESC, where we house volunteer firemen, ambulance, and police down in Orangetown. That's what I got.
Okay, are there any questions for this appointee? Okay, hearing none. All those in favor, please signify by saying aye. Aye, opposed, say nay. Carried unanimously. I think you heard my spiel with the other
Yes, sir. Thank you
appointee,
very
but
much for your time, folks. I know
if
you got a lot.
if you'd like to come, of course, feel free, but it's not necessary.
Thank you
Okay,
very much.
thank you for your time in advance. I appreciate
Keep
it.
up the good work, folks. Thank you.
Thank you. Okay, we're going to take all the other items together that have not been yet voted on. Are there any questions on any of them before I move them all? Okay, hearing none. I'll move them, seconded by Legislator Jobson again. All those in favor, please signify by saying aye. Opposed, say nay. Carried unanimously. Motion to adjourn by me, seconded by Legislator. Oh, last item. Well, we can't move in second and vote on a discussion item. I know. No, you're right. Is anybody here for that? Excellent. Okay. All right. Thank you very much, Mr. Saber. How are the sewers doing? At least this
Better than
quarter.
others, how's that?
What's that?
Some days better than others.
You know, that's always the way it is. Have we had any, what's Confucius's curse? May you live in interesting times. So I'll ask whether we've had any interesting things happen in the last quarter that you want to discuss with us or tell us about.
Well, I'll have better news next quarter because it looks like we might be settling some lawsuits. So the current report stands, but it looks like we may have some for next quarter, which will be better. We did have a number of spills, but only one was weather related, and that was due to a 4-inch rain event in Clarkstown. That was back in April. A lot of the other stuff were rags and some blockages that we're working on how to resolve those so we don't have future incidents at the same locations.
Okay, and are we involved at all in the wipes lawsuit still? Or is what's going on with that, if anything?
We're involved as far as we've petitioned all the federal and state elected officials to support the laws that are proposed or the bills that are proposed for laws for the wipes. I know we're part of the joint action suit for the Charleston, South Carolina one, because I
Right.
received something on that. So we are part of that. I haven't received
Okay,
a
good.
resolution
So
on
we
that
have,
yet.
are we a plaintiff in that suit? Did we join it?
Somehow we got just brought into it. I received a notice in the mail from one of the attorneys that we were part of the class action suit.
Okay, can we get it as an action item to ask the county attorney's office whether we're actually a plaintiff in that case? What's that? Yeah, let's see what's going on.
It sounds
whether
like there was
we're
a
part of
class
the
action notice, not that we're actually a named plaintiff in the class action, but let's get.
Right, well, that's fine. Let's just confirm that. Thank you. Thank you, Legislator Wolf. Just to confirm whether we are a part of the class action suit coming out of Charleston. against the manufacturers of the flushable wipes that aren't that aren't quickly degradable, which has created tremendous issues in sewer systems nationwide. Right, that's why I changed it to degradable from flushable or quickly degradable. It's very interesting, the testing that they've done to show how these wipes that are allegedly supposed to fall apart don't. They actually colored the wipes and then flushed them and picked them up miles down the systems, fully intact, to show that the claims were just false, the ones that are made on the packaging. Anyway, do we have anything else? Legislator Weider.
Like to add to the report that I had an issue that I reached out to Mr. Saber, and he was very accommodating and available, and I appreciate his information and assistance. So if we can add that to the report, that was in this past quarter.
Sure, absolutely. Thank you. Okay, anything else? So that's accepted. Thank you very much, sir. We appreciate your assistance and expertise on our behalf. Now, a motion to adjourn by myself, seconded by Legislator Grant. All those in favor, please signify by saying aye. Opposed, say nay. Carried unanimously. We are adjourned. Thank you.
I would like to call the Budget and Finance Committee called for Tuesday, July 26, 2022 meeting to order. And I would like to ask our clerk to do the roll call.
Legislator Jobson. Legislator Hofstein. Legislator Yeager. Legislator Soskin.
Here.
Legislator Hood Jr. Legislator Earl. Legislator Cornell.
Here.
Second Vice Legislator Wolf. Vice Chair Legislator Grant. Chairman Legislator Weider.
I'm here.
You have a
So
full
with the
house.
exception of Mr. Brennan, and the Commissioner of Social Services and Mr. Fazzetti and RCC, I believe there are no any other new items. People don't have to stay. They're welcome to stay, but they don't have to stay. So we're going to start first with actually the last item on the agenda, which is item number 7.4, referral number 95381, accepting report of budget and fin. What was it? Right, so I'm doing one. Accepting report of Budget and Finance Committee after its review of the Rockland Community College proposed 2022-2023 budget. Moved by Legislator Wolf, seconded by Legislator Yeager. On the discussion, we have someone from the community college, Rockland Community College, to just give us a very short
Yes, thank you very much.
synopsis.
Appreciate
of
the
budget.
opportunity to address you. My name is Marty Wardendijk. I am the chairman of the Rockland Community College Board of Trustees. And I'm here tonight because I think that you are our sponsor and you're so important to the college and you should know a little bit about what's going on. We're currently in the process of doing a search for our 8th president. In the meantime, I would like to introduce you to our person that's running the official in charge, Dr. Sue Deer, who's here. And I'd like to just let you know that she's been in education for 35 years and in leadership positions at Rockland Community College for 14 years. And she's quite capable of leading the college until this search is completed. So I thought you ought to know that. And I thank you. I'd like to let her just say a few words.
I'll be brief. It was 35, might even be more than that, but we don't admit that. Anyway, I'm very happy to be here tonight. I've been at the college for 14 years. I was at Orange Community College for 2 decades and decided to come to Rockland. It was a great choice on my part. I worked very closely for 9 years with Dr. Wood. We were very close. I had coffee with him 2 to 3 times a week. And then when he handed the baton to Dr. Baston, the foundation was set and we were ready to move forward. And so we have a guided pathways model to keep students at the college. We have an enrollment management plan, and we're really working. My goal is to work with the community to reach out and make sure that our students are career ready and real world ready. So I'm very excited to hold this position, even if it's just for a year. And I look forward to a new president coming in, and I look forward to moving us forward. We're not going to tread water. We're not going to make major decisions, but we're absolutely going to continue to grow. So I'd be glad to answer any questions if anybody has them.
Any, a small synopsis of the budget of 2022 and 2023, briefly, anything?
Dr. Dobell will speak to that. Doctor's the CFO.
And we could all circle back for questions.
Thank you, everybody. The budget is based on 4,000 FTE. We had no increase this year in fiscal 23 for tuition or fees. We are coming before you asking for a 1% increase from our sponsor contribution. We have not, this will be the first time we've had an increase in over 3 years. That will equate to $178,000 to the county. That's the big picture. We are increasing our budget because we're using some federal money to move into other areas, some the gig economy. Our analysis of what we need to offer to our students brought us to that point. So, any other questions? Happy to answer. That's it in 30,000 feet.
What's the total budget?
Total budget, 72 million.
And a portion of the county contributes?
How much does the county contribute?
Yes.
17 million, 17.8. So 1% increase of $178,000.
1% on top of the contribution of the county,
Correct. So it'll go up to 18.
and which would be less than 1% or 0.5% of the overall budget, the
Yeah.
increase. In
Absolutely.
other words, the increase of the overall budget is just 178,000.
No. The increase in the overall budget is about $5 million compared to
500?
last year.
500,000.
$5 million.
5 million.
Yes.
And that comes from?
Comes from 3 sources: the state, the students, and you. Oh, the additional money? Yeah, federal money. We get, we're getting, we budgeted $6 million of HERF money, which is a Higher Education Emergency Relief Fund. And that's the stimulus money. We budgeted $6 million to supplement this year's budget, the fiscal 23 budget.
So the increase of the overall budget is $5 million.
Correct.
And the majority of the money comes from federal
Majority of
grant.
the increase?
Yes.
It's coming from the federal government primarily. It's helping us move into these other directions.
And are these one-time grants?
The HERF money is done at October of 2023. So it's, we're done with that.
Is that going to put a strain on the overall budget?
We don't anticipate that. We are anticipating that we are going to, these additional programs that we're initiating are going to bring into the college additional dollars to get us to the top. Now, then they're going to get us, the fiscal 24 is what we're looking at. We're looking at life after HERF. And so we want to get ourselves up to a $72 million revenue budget by fiscal 24.
What was the increase of last year from the year before?
As far as tuition, or I'm sorry,
No,
as far
the
as
budget, the
there was 0% in 21, there was 0% from the county in 22, and now we're asking for 1%.
But I'm talking about the overall budget.
The overall budget,
Yes.
it's I think we're about 67 the previous year in fiscal 21. I don't have that right in front of me.
Any questions? Okay, any questions? Seeing there is none, I'll call the motion. All those in favor say aye. Opposed?
Aye.
The motion carries unanimously. Item number 74, referral number 95382. Adoption of the 2022-2023 Rockland Community College budget. Moved by legislator Wolf, second by legislator Hofstein. Any discussions? I think we already discussed this extensively. Seeing there is none, I'll call the motion. All those in favor say aye. Opposed? The motion carries unanimously. Okay, so now we're gonna move on to item number 7.1. Mr. Brennan? You with us?
Yes, I'm here.
Okay. Item number 7.1, referral number 8183, approving intermunicipal cooperation agreement between the County of Rockland and the East Rampart Central School District for use. The U missing. Okay?
It's for use.
Yeah, yep. That, we picked up on it, so, that's gonna be correct. It's for use of the county's fuel pumps at the Pomona Complex for the term from March 1st, 2022 through December 31st, 2023, and authorizing execution agreement by the county executive moved by legislator Grant, seconded by legislator Cornell. On the discussion, Mr. Brennan, March 1st. And now we are in April, May, June, July. Almost August.
It was a little bit delayed in dealing with the school district. We've had this agreement in place for a number of years. For some reason, they sent it to outside counsel, who rewrote it in a way that wasn't acceptable to the county. So we had to go back and forth with the school district and said, you know, the county's letting you use our pumps, so we're gonna use our contract. And we finally worked it all out, so that's why there was a delay.
Okay, good. Any questions? Seeing there is none, I'll call the motion. All those in favor say aye. Opposed, the motion carries unanimously. Item number 7.2, referral number 9414, approving exercising a second renewal option term in the second amendment to the agreement, X of $100,000, adding $50,000 for new total contract amount not to exceed $190,000 under RFPRC 2019-026 with Capital Market Advisors LLC to provide financial advisory services for the term from July 29, 2020 through July 28, 2023, with the one-year renewal option remaining, authorizing the execution of county executive moved by legislator Wolf, seconded by legislator Yeager. On the question, Mr. Brennan, just like a 5-second synopsis on this?
Sure, this contract is requested by Mr. DeGroat, the Commissioner of Finance. Capital Market Advisors assists the Finance Department in our bonds and getting all the data collected and necessary to present to the rating firms, and they're intricately involved in our capital borrowing process.
And how long have they advised the finance department?
On and off over the past 20 years.
Good. I guess the county was happy with them.
Yes, Mr. DeGroat is very happy with them.
Good. Any other questions? Seeing there is none, I'll call the motion. All those in favor say aye. Opposed, the motion carries unanimously. Now we're gonna go to the addendum. No, but I have people waiting, so I'm keeping that. Okay, so I just want, people probably want to go back and do some barbecue, so, okay. I will do the addendum. Item 7.5, referral number 8270, establishing one position in the Highway Department, moved by legislator Grant, seconded by legislator Jobson. Seconded by legislator Jobson. On the discussion, Mr. Vizzetti, we looked at the backup data, and this is a position that actually I've been involved in,
Yes, Mr. Chairman. This is a position that, over the years, we did ask for an additional position down there, but with the advent of COVID, the last two budgets, we didn't feel it was necessary. We had a decline in the number of permit requests and reviews that we're having to do. However, now that we're coming out of it, we're pretty much being overwhelmed. And the one fellow who has been doing our reviews with the drainage agency, of course, he goes on vacation, and that when he goes on vacation, we need somebody to review it. Also, we're having a number of retirements coming up in the department, and it's our opportunity to bring on a new young engineer who can be trained in the department's policies, and it'll be a big benefit not only to ourselves, but to the general public.
Good. Any other questions? Seeing there is none, I'll call the motion. All those in favor say aye. Opposed, the motion carries unanimously. Item number 7.6, referral number 9173, establishing 7 positions, abolishing 7 positions in the Department of Social Services. Moved by legislator Earl, seconded by Chairman Hood. On the discussion, Mr. Madam Commissioner, just a 10-second synopsis. I know we're abolishing positions and we're creating positions, we're reclassifying positions.
Yes, this has minimal budget impact. We continually have retirements in the department. We continue to try to realign and get corrected type people in the correct titles as we move forward to how we want to organize the organization. And pretty much each one of these are doing that. There's some language that we need in certain positions. We're asking for that, as well as the other big thing is the senior community builder, which is a little bit different from anything else. And that position is for the Section 8 program. We've just gone through a rather lengthy RFP process, first time that has been done in the history of HUD to RFP out the administration of HUD vouchers. So we were very successful in obtaining that award. And in addition, we received additional vouchers, and it's really necessary to add a person to one of those positions.
Any questions? Seeing there is none, I'll call the motion. All those in favor say aye. Opposed, the motion carries unanimously. Thank you,
Thank you.
Commissioner. So we're gonna move on to item number 7, I believe, Mr. Brennan. You could leave. You're welcome to stay, but
Okay, thank you. Good night.
good night. Okay, item number 7.3, referral number 9534, appropriating the sum of $1,250 to American Legion, Carl Thielen Post 1271, Orangeburg, New York, for patriotic observances in 2022, moved by legislator Wolf, seconded by legislator Hofstein. We try to do bipartisan. Any discussion? Seeing there's none, I'll call the motion. All those in favor say aye. Opposed, the motion carries unanimously. So now we're gonna move all the items on the previous committee meetings. So we're gonna go to Planning Public Works, item number 1-1, all the way through item number 1-9. Moved by legislator Wolf, seconded by legislator Jobson. Any discussion? Seeing there is none, I call the motion. All those in favor say aye. Opposed, motion carries unanimously. Now we'll do multi-service. Item number 2-1, all the way through 2-8. Moved by legislator Soskin, seconded by legislator Grant. Any discussion? Any discussion? Seeing there is none, I'll call the motion. All those in favor say aye. Opposed, the motion carries unanimously. Public safety only has one item. Item number 3-1, referral number 5327, approving purchase X for $100,000 from purchase of an additional amount of $100,000 for new total contract amount not to exceed $187,788.68 under RBRC 2021-001 from Atlantic Technical Inc. for the purchase of additional law enforcement EMS and fire and emergency service equipment and related supplies for the term from February 26, 2021 through February 25, 2024. Moved by legislator Hofstein, seconded by legislator Soskin. Any discussion? Seeing there is none, I'll call the motion. All those in favor say aye. Opposed, motion carries unanimously. I'll entertain a motion to adjourn. Moved by legislator Jobson, seconded by legislator Yeager. Any discussion? Seeing there is none, I'll call the motion. All those in favor say aye. Opposed, motion carries unanimously. Thank you very much.
Okay.